Hello and welcome. Today we're diving into a complex and potentially serious condition affecting the urinary system, ureteral perforation. This occurs when the ureter, the tube that carries urine from the kidney to the bladder, is punctured or torn. Understanding the causes, symptoms, and treatment options is crucial for effective management. Let's begin our exploration. Ureteral perforation can arise from various sources, but most commonly, it occurs as a complication of medical procedures. These include ureteroscopy, a procedure where a thin scope is inserted into the ureter to diagnose or treat conditions like kidney stones. Other contributing factors include external trauma from accidents, surgery performed near the ureter such as colorectal or gynecological procedures, or even spontaneous rupture, although this is rare. Pre-existing ureteral diseases, such as strictures or tumors, can also weaken the ureter, making it more susceptible to perforation during interventions. When the ureter is perforated, urine leaks into the surrounding tissues of the retroperitoneum or the peritoneal cavity, depending on the location of the injury. This leakage triggers an inflammatory response. The body attempts to contain the leak urine, which leads to the formation of a urinoma, a collection of urine outside the urinary tract. If left untreated, this can cause significant complications, including infection, abscess formation, and damage to surrounding organs due to inflammation and chemical irritation. The severity of the pathophysiological response depends largely on the size and location of the perforation, as well as the duration of leakage. Accurately determining the exact prevalence of ureteral perforation is difficult because it often goes unrecognized, especially in minor cases. However, it's estimated that ureteral perforation occurs in approximately 1–3% of ureteroscopies. The risk is higher in complex cases involving large or impacted stones, or in patients with pre-existing ureteral abnormalities. Rates may also vary depending on the surgeon's experience and the specific techniques used. More broadly, iatrogenic injury to the ureter is documented between 0.2% of open surgical procedures. The signs and symptoms of ureteral perforation can vary widely, depending on the size and location of the perforation, as well as the time elapsed since the injury. Some patients may experience immediate and severe flank pain, while others may have only mild discomfort. Common symptoms include abdominal pain, nausea, vomiting, fever, and hematuria or blood in the urine. In some cases, the only sign may be a persistent ileus, which is a temporary paralysis of the intestines. If the perforation is large and left untreated, signs of sepsis, such as rapid heart rate, fever, and confusion may develop. Diagnosing ureteral perforation requires a thorough evaluation, including a detailed medical history and physical examination. Imaging studies are crucial. A CT scan with intravenous contrast is generally the preferred method, as it can visualize the perforation site, the extent of urine leakage, and any associated complications, such as urinoma formation. A retrograde pyelogram, where contrast dye is injected directly into the ureter, can also be used to identify the site of perforation. In some cases, an ultrasound may be helpful, but it is less sensitive than CT or retrograde pyelography. Blood tests may be performed to assess kidney function and check for signs of infection. Ureteral perforations can be classified based on several factors, including the mechanism of injury, the size and location of the perforation, and the degree of urine leakage. A common classification divides them into minor perforations, such as mucosal tears or small punctures that seal spontaneously, and major perforations, which involve complete transection of the ureter or significant extravasation of urine. The severity of the injury guides the management approach, with minor perforations often managed conservatively, while major perforations typically require more aggressive intervention. The treatment of ureteral perforation depends on the severity of the injury and the patient's overall condition. Minor perforations may be managed conservatively with placement of a ureteral stent. The stent allows the ureter to heal by diverting urine flow. Antibiotics are often prescribed to prevent infection. Major perforations usually require surgical intervention. Options include primary repair of the ureter, ureterostomy reconnecting the two ends of the ureter, ureteroniocystostomy a reimplantation of the ureter into the bladder, or, in some cases, nephrectomy removal of the kidney if the damage is irreparable. Minimally invasive techniques, such as laparoscopy, are increasingly being used to repair ureteral perforations. The choice of surgical approach depends on the location and extent of the injury, as well as the surgeon's expertise. Preventing ureteral perforation is paramount, especially during endoscopic procedures. Careful surgical technique, proper instrumentation, and thorough knowledge of ureteral anatomy are essential. Surgeons should be aware of potential risk factors, such as pre-existing ureteral abnormalities or a history of prior surgery. During ureteroscopy, gentle manipulation and controlled use of instruments can minimize the risk of injury. Prompt recognition of any signs of perforation during a procedure is crucial, as early intervention can prevent further complications. The use of smaller caliber instruments may also lower the risk. The prognosis for ureteral perforation is generally good, especially with prompt diagnosis and appropriate management. Minor perforations typically heal without long-term sequelae. Major perforations, if treated surgically, also have a high success rate. However, delayed diagnosis or inadequate treatment can lead to significant complications, such as ureteral strictures, hydronephrosis, a swelling of the kidney due to urine backup, and chronic kidney disease. Recent research focuses on developing new techniques to prevent and repair ureteral perforations, including the use of bioresorbable materials and advanced imaging modalities. Future advances may include robotic-assisted surgery for complex repairs and regenerative medicine approaches to enhance ureteral healing. Continued research and improved surgical techniques will further improve the outcomes for patients with ureteral perforation.